Reiki. How much scientific validity is behind Reiki, and from your experience at Harvard, has it worked in healing people?
Right. Yeah, that's a really, really good question. And so we've talked a little bit previously about the restrictions of funding. So that's a huge issue. So I think there's about 80 or so studies currently, which is very small for a new field.
Okay.
So over decades. And they vary a lot in terms of their methodological quality. So frequently, nurses will practice Reiki. So it's being practiced in hospitals all over the United States, and integrative medicine units of hospitals are integrating Reiki, and they're using it because the patients want it, despite the research being subpar at the moment. However, there are research studies that are of higher quality, and randomized controlled trials is sort of the gold standard of research. So people are randomized to Reiki, treatment as usual, or what's called sham Reiki. And that's really important because people, critics of Reiki will say, well, it's placebo, or you just like being with someone and they're putting your hands on you and that's nice. And so of course they're going to get better. So researchers will introduce sham Reiki. And so that's all the physical aspect of the Reiki treatment, so putting the hands on, but not sending the energy. And so there's a few studies with this, and one recently published looking at knee surgery. So people that have postoperative knee pain, obviously, is common from surgery. And so we have like standard treatment, and then we have someone having the standard treatment and Reiki, and someone having standard treatment and sham Reiki. And we found like significant, or members of my research team has found significant increases in those receiving actual Reiki compared to sham Reiki in terms of pain and medication use. And so those are the strongest research studies, and they require funding. So that was a funded study because it takes a lot of time, and you have to compensate patients, and there's measures you have to take. And so the quality is increasing despite not so much funding, but we're definitely trying. And I'm part of the Center for Reiki Research, and we're transitioning to a nonprofit so that we can hopefully generate donations and funding through individuals that really want to see these practices be shown and backed scientifically in some way because they've experienced the benefits of it. So Harvard Medical School has like one of the largest programs in Reiki, and despite some people may think, oh, Harvard's leading edge, so clearly they think this is BS. Well, it's not necessarily the case. Yeah. So the research is there. It's not where we want it to be by any means, and it's once again a funding issue, but hopefully that transforms.
But there's obviously enough behind it and enough validity behind it for like people like yourself and your colleagues to obviously take such big initiatives like this.
Yeah, and we recently ran a study. Actually, it's being written up right now, so it's not published yet, but it's going to be the largest Reiki study that's been done. Now, it's of low methodological quality because we didn't do a randomized controlled trial, but we want to see in real life what's going on. There's a lot of value in like the practical application, what's really happening in the real world when people are having Reiki. So we have 1,500 people that took a Reiki treatment, and we measured before and after. We looked at their mood, their pain, their anxiety, depression, all of these things. And then we do like after the treatment, what do those measures look like, and also their experience. And we found statistically significant, highly statistically significant, with a high effect size, which is important for scientists, reductions in depression and anxiety, pain, fatigue, basically all the measures we looked at were improved. So in the real world, it is absolutely helping people. So we just need to do like a little more high quality design that can convince the skeptics a little more.